Hi, it's Felicity here from Bankery Spinal Health, and in this video I'm going to talk about things that you can do from a bodywork perspective for a baby who you think has a tongue tie or a restriction in the tongue. So before we start, it's really important that you understand that I am not diagnosing a tongue tie in your baby. This is a video for people who have a strong belief that their baby does have a tongue tie. Maybe you're waiting to have it snipped. Maybe you're waiting to see a chiropractor or an osteopath to have a look at your baby. Or maybe you have to wait a long time to be seen by somebody to get a diagnosis. Maybe you live somewhere where there's just nobody around who can help. So my job here is to show you 3 really easy things, very gentle stretches and exercises you can do with your baby, totally safe, that might improve feeding in the short term before you can get that tongue tie assessed. Okay, so here we go. So this is my baby here. I know it's not a real baby, but it's much easier for me to demonstrate things on my baby here, and I don't have a real baby just now to show you. So first of all, you need to understand a little bit about the anatomy of the tongue. So your tongue has a lot of muscle. Your tongue is basically made of muscle, and it attaches down to the hyoid bone, which is here, by lots of soft tissue and fascia and muscle, and then there's some more muscle that comes down here. So obviously it's really important from a bodywork perspective that if there is a frenulum there that's too tight or too short, that is restricting the tongue movement, there's nothing that can be done about that until it's snipped. However, if there are some tight muscles or fascia anywhere else around the tongue or the jaw or the neck, there's lots that can be done about that, and I'm going to show you what you can do at home in a really safe, gentle way. So the first thing that you want to do, try and do this when your baby's relaxed. Usually after a feed and when they're not overly tired is the best time. So the first thing I'm going to show you is, this is a baby cushion. It's actually just a dog bed. So if you have anything like that, that would be fine. Or just, pop a blanket down and pop them on the floor. So the first thing we want to do is just massage all the tissues underneath the jaw. So there's a jawbone that goes along here, and you want to just massage the muscles underneath. So I do it with my middle fingers, and I take them underneath. So you'll usually, it'll be the bit where your baby's got a bit of a double chin, and you take your fingers on each side here, and you gentle circular movements like that. Okay, most babies love this. Like I say, if your baby's well fed and relaxed and not overly tired, they usually do quite enjoy it. You want to not be digging your fingers underneath, and we always use eyeball pressure. So the pressure that you would comfortably put on your eyeball, move it around that way, that is the most amount of pressure that you need to use. Now you really can't do this too often or too much. I would say if you're having really severe problems, you can do this every few hours if you want to. So I would do it for maybe 10 seconds, have a rest. If baby's still happy, do it again. If baby's still happy, do it again. And then you can repeat that every couple of hours. Or if it helps you to remember, I remember what it was like with baby brain when you haven't slept very much. If it helps you to remember, do it every nappy change, something like that, when baby's nice and relaxed, or after a feed if they haven't fallen asleep, or if they have fallen asleep, sometimes you can get away with it if they're still a newborn. So that's the first one. And so your jaw here is called your mandible, so we call it the submandibular massage. So just like that, you can do that. Okay, so number 2, the second thing you can do is, like I said, a lot of the muscles go from your mandible to your hyoid, which is the Adam's apple bone here, and right down. So what might help with feeding, because you need the baby to be able to tilt their head back for optimal positioning when you're breastfeeding, is we want to try to stretch out that part of the baby if we can, doing it really, really safely. So we can do this indirectly by massaging the front of the baby. Again, when they're lying in this position on their back, you want to just make sure the head's tilted slightly back, and you can just give them a nice stretch down the way. And again, I'm using very minimal pressure here. It's more of like a stroking pressure. If you do this and you notice the baby's chin is coming down, what you can do is take one hand and just very gently touch the chin there and just stroke with the other hand, just like that. Very, very simple. Anybody could do this. It's like a baby massage, so don't be scared to try these things. It's totally safe. Chances are, if mum or dad are doing it, somebody that the baby knows, the baby's going to have a whale of a time. Okay? So that's number 2. Just a soft stroke down the front of the baby's torso, making sure the chin is up as well. So you're just opening that area there. Okay, so number 3 is very similar, and it's called the Guppy, but you're just positioning the baby slightly differently. Okay, so this is number 3. It's called the Guppy, and I'm trying to remember the name of the lady who started this initially, and I can't remember, but I'm sure if you Google the Guppy, you'll see it. So basically, you want to take your baby, and there's a few different ways that you can hold your baby doing this. So what we're trying to do is lay our baby down and get the head slightly lower than the rest of the body. Okay, so we're encouraging the baby to do this. So what you want to do is hold the torso and hold the head, so you have control of the head being lower than the torso. So you want the baby to just be like this. Notice that I am in complete control of the baby the whole time. I'm not leaving them here for minutes and minutes and minutes. We're literally 5 seconds and then back up again. Very slow, controlled movement. If you have a very big baby, you can always cuddle them right in, use 2 hands and bring your whole body down here. If that's easier for you, you can do that. That's no problem. Okay, so we're really just trying to open up that space between the chin and the chest, okay? Because oftentimes if the tongue is too tight, then all the fascia and the muscles at the front here are too tight as well. So hopefully you feel confident enough to do that at home. If you don't, if you're still struggling and you think that some body work might be able to help your baby, please do get in touch. We run a baby clinic on Tuesday mornings from 10 till 12. If you're not available to attend the baby clinic, we run online consultations with myself, and we can go through everything that your individual baby might need. I'll give you the confidence to do these things at home, and I'll give you any other advice or anything that I think might be helpful. So I'm also a breastfeeding counsellor and training to become a lactation consultant as well. So sometimes there are changes in positioning and things that can be helpful. And yeah, hopefully these are just some little tips that you can do in the meantime. Okay, thanks for watching and let me know what you think, and I'll speak to you soon. Okay, bye.